The Health Information and Quality Authority looked at compliance with infection prevention and control at Belmullet Community Hospital during the COVID-19 pandemic. Risk-based announced inspections were carried out between July and September at 3 rehabilitation and community inpatient healthcare services, including at St Patrick's Hospital and St Camillus' Hospital. It determined that increased oversight of infection prevention and control was required within the governance structures of the HSE Community Healthcare Organisation Area 2, that's in this region. HICWA says it was not clear if escalated risks from Belmullet Community Hospital were being enacted on at CHO2 level. HICWA also advised that local risk registers in hospital need to be better managed, reviewed and escalated in line with national policy. They say the antimicrobial stewardship programme needs to be progressed at the hospital, and as well as oversight and auditing of environmental and patient equipment hygiene. They called on the CHO2 to formalise access to specialist staff with expertise in infection prevention, adding that there was a lack of formal training provided to multitask attendants on the cleaning systems. They further found that long-standing infrastructural and maintenance issues were identified, which could have the potential, they say, to impact infection prevention and control measures. Erris-based Sinn Féin Deputy Rose Conway-Walsh claims that the issues raised in the HICWA report were known for months, and she is asked why they have not yet been tackled. She told Midwest News that maintenance work promised for the North Mayo Hospital should have been done months ago.
That's right, John. Yeah, and I've had an answer back to a PQ just from the HSE on yesterday, and it points out that it highlighted the need for a significant maintenance programme to be carried out to ensure a safer environment for both patients and staff. Well, my question is, why hasn't this work been done? We didn't need a HICWA report to tell us what needed to be done. I mean, there's maintenance that needed to be done in Belmullet Hospital for months and months now. We've talked about this several times before in terms of the maintenance being attached to Mayo University Hospital, and then the detachment of that, and then the failure to appoint maintenance staff to the community services to get that work done. So I suppose this HICWA report should be no surprise to anybody. Now, they have said in the last couple of weeks that they're going to do that maintenance work, but, you know, it should have been done months ago. That's my point. This maintenance work and the infection control work should have been done months ago.
Yeah, well, this report, of course, it was carried out between July and September, assessing how this compliance with infection prevention had run its course during the pandemic. But there was other issues as well raised in relation to Belmullet Hospital specifically. One of those was that in terms of infection prevention and control, that the escalation of the concerns wasn't resulting in a sufficiently timely and reciprocal manner. Now, that's a concern in terms of controlling the virus.
Of course it is. And that's why when, you know, we've had months to prepare, you could say going into in the first case in March, even though we've continuously been going on about the neglect of Belmullet Hospital, that nobody foresaw a pandemic. But we knew what was likely to happen in terms of a second wave and in terms of what needed to be done. And yet we didn't have the urgency or the actions there to put the infection control measures into place. And I suppose that's why they've reduced the bed capacity from 20, well, obviously from 40 in the first instance, but from 20 pre-COVID to now 12 beds that are available. So, you know, you're lessening the pool of beds available all of the time. That's why these works need to be carried. There's no getting around this, John. These works have to be carried out urgently. There are enough people unemployed in the Erris area and in the wider Mayo area, people who can carry out this maintenance work and carry out any works that need to be done. That is aside from the larger capital investment that we've been asking for Belmullet Hospital for years to serve the population, the huge population and hinterland of the Erris area. So I hope that this HICWA report will act as an instigator or an urgent reminder to all of those involved and all of the decision makers to get this works and get these works carried out as quickly as possible. Not only should it be reinstated to the 20 beds, but to the original 40 beds that were in Belmullet Hospital, because everybody in Erris, it's very plain to everybody in Erris that hospital there is a fine hospital structure, that you can have so many services in there that completely coordinates with the Sláinte Care plan and what needs to be done in terms of healthcare delivery in communities. That hospital is ideally suited. That's aside from having the long-promised primary care centre that's been promised for Bangor. But, it always seems to be just an afterthought for the north of the county. We only have to look even in terms of what's been happening in the Belmullet Hospital and the nonsense there, and I have several questions in around that, and the non-communication with staff and the debacles there. HSE need to get their act together. They need to get their act together in relation to the district hospitals, Belmullet Hospital and Belmullet Hospital, and obviously Swinford as well. But we can't be in a crisis management situation all of the time. They have to plan, and the works, like were cited in the HICWA report, have to be carried out. But as I say, we shouldn't need a report because the HSE already have all of that information.
And that's Mayo Sinn Féin Deputy Rose Conway-Walsh.